Hi everyone, Colleen here, and welcome back to bALS. I want to thank you for watching my videos and remind you to hit the like button and the subscribe button. My videos will be coming out less frequently, so by subscribing you'll be able to get those notifications when my videos do come out in the future. Today, I'm going to talk about my chompers, my teeth. About 6 months after onset, I noticed this very strange thing. My teeth would like tap each other right here in the corner. I've never been able to recreate it. I still am unable to do that. But every once in a while, very randomly, the teeth would tap each other. Very strange. Add to the list of other strange things that were happening during that time prior to diagnosis. About 9 months after onset, right before my diagnosis, we had limited the number of diagnoses of different conditions we were looking at. I noticed that my bite, when I bite down, was not right. It wasn't where it was supposed to be. Like my teeth were shifting. So me being curious, I typed up the different conditions to see if any of them had shifting of the teeth. And up pops a picture of Stephen Hawking with his jaw sticking way out. ALS. Well, I read the article. I found it very interesting. I do not remember the name of the article or who wrote it, but it doesn't matter because I'm paraphrasing. In the article, it talked about how our teeth shift normally all the time. Anybody who has had one of those athletic mouth guards, retainer, or even a partial, if you have not worn it for a couple of days and you put it back in your mouth, you notice it doesn't quite fit the same, but eventually it goes back to where it belongs. So our teeth are shifting all the time. But with the ALS patients, with the weakness here, normally our cheeks and tongue keep our teeth generally in the same position. Having the weakness, the teeth shift more towards those weak areas. The stronger areas kind of push the teeth into the weaker areas, and then we have some teeth shifting around a little bit more. So I found that article very interesting, and I had started to just go like this, just to keep my teeth reminding them of where I want them to be. Not clenching, I'm not clenching my teeth, but holding it lightly, just reminding my teeth of where I want them to be. So time goes by, and about March or April of 2020, sure enough, I feel that maybe there's some food or something stuck in my teeth here. it just didn't feel right. And of course, with everything being shut down and my dentist being closed, I felt I had to take it upon myself to keep that area clean and free of food as best as I can. So I bought myself this little kit here so I could work on keeping that area clean and free of food getting stuck in there. It even has this tongue cleaner. Worked on that quite a bit. Well, eventually the dentist did open, and when they did, they had quite a backlog. So I had to wait a few more months before I was actually able to get into the dentist. So today I want to share with you my dentist appointment, where we take a look at my chompers. I have to tell you, I was pretty nervous about going there. I had heard rumors that some dentists did not want to see ALS patients. And for me, I was nervous for myself because I was hoping I didn't have any cavities, which might require some dental work. And I was worried about being reclined in the chair too far back. Would I be able to keep my mouth open? Am my tongue gonna get in the way? Am I gonna have extra saliva? Am I gonna start choking or gagging? Or the teeth tapping while the dentist trying to do something in there. I was pretty nervous and I did not know what to expect. So as soon as I got in there, I told the hygienist about my diagnosis, and she was fabulous. She really worked with me. Reclined the chair back, but not too far, so I felt comfortable there. And she let me hold this suction thing, which was really nice because I was able to suction out when I felt the need to do that. So she was very good with that. We took a lot of breaks. And I was not surprised to find out I had some extra plaque in there because with the atrophy in my tongue and having a hard time wiping the food off, and I have been trying my best to brush and floss. So wasn't too surprised by that. We had the x-rays. I did really well with that too. So feeling pretty good. Then the dentist walks in. Guess what? No cavities. No cavities for me. So the dentist said he was quite pleased with my hygiene, that I've been doing a good job keeping my mouth clean. So he recommended that I continue with the flossing. That's very important. I've been using a little flosser. I keep a bunch of these in my purse, and then I use this kind when I'm at home, just keeping that food out from in between my teeth. So I recommended keeping that up and keeping my enamel strong too. So with the reducing the chances of getting the cavities and needing any dental work in the future, we want to keep up with that. He also said that with regards to my teeth shifting around, if it continues to get worse, he can recommend an orthodontist who can make some kind of mouth guard or something to keep my teeth in the position. He also recommended a water pick. Kind of nervous about that. Not sure how I feel about water spraying everywhere. He said I would have to lean over the sink to do it. But I'm also afraid of accidentally shooting the back of my throat and having some kind of gag reflex. I'm not sure how I feel about that. But I did take him up on his recommendation for electric toothbrush. So I found a pink one. I have started to use this very interesting sensation I'm still trying to get used to. But this should help reduce a plaque and some of that wear and tear on my hand and shoulder. Now I still like to use my old toothbrush to get the food out from between my gum and cheek. Sometimes there's some good sized pieces in there. I also prefer this for cleaning my tongue too. So a quick rinse through with this before I pull out my electric toothbrush to really get in between and clean out my teeth. So very happy with my dental visit, and good news for me. I also want to remind everybody else of our key takeaways. Keep your mouth clean, flossing, keep your enamel strong, and hopefully eliminate that need for any dental work at all. So, thank you for watching, and as always, thank you for being a part of my journey.